How to use a PMDI inhaler for asthma. When you are first diagnosed with asthma, your nurse or physician will show you how to use the inhaler that you have been prescribed. You will also find instructions with your medication. You should always read the instructions before use, but if you are still unsure, please contact your physician, nurse or pharmacy. In this short video, we are going to show you how to use a pressurized metered dose inhaler. You may simply know this as a puffer. Getting your inhaler technique right is critical in managing your symptoms, as it will help avoid over or under medication. It may take a few tries to feel comfortable using your inhaler, but it does get easier with practice. We advise following this simple step-by-step guide. Step 1. Test. When you get your inhaler, or if you haven't used it for 4 days or more, you should test it. To do this, just take the cap off, give the inhaler a good shake, and press the canister to release a puff. Make sure to point the mouthpiece away from you when you do this. Step 2. Positioning the inhaler. Once you have tested your inhaler, hold it upright and take the cap off. Check that the inhaler mouthpiece is clear and then shake the inhaler again. Step 3. Position yourself. Sit or stand up straight and slightly tilt your chin up. This will help the medicine reach your lungs. Make sure that you are comfortable and that you have some support if you need it. Step 4. Take a puff. In one smooth action, turn your head away from the inhaler and breathe gently and slowly until your lungs feel completely empty. Now, turn back to the inhaler and put your lips around the mouthpiece of the inhaler to make a tight seal. Breathe in slowly and steadily, and at the same time, press the canister on the inhaler once. Continue to breathe in slowly until your lungs fill full. Step 5. Hold your breath. Now take the inhaler out of your mouth and, with your lips still closed, hold your breath for up to 10 seconds or for as long as you easily can. Then breathe out gently away from your inhaler. Step 6. Repeat. If you have been prescribed a second puff, wait for up to a minute and shake the inhaler again. Then repeat steps 2 to 5. Step 7. All finished. When you have finished, replace the cap on the inhaler. Don't forget to rinse your mouth if your inhaler contains steroids. This will reduce the chances of unwanted side effects. Should you struggle with your inhaler, please get in touch with your physician, nurse, or pharmacy, as they can advise on additional help, for example, using a spacer with your inhaler. Visit our website, sign up to our monthly newsletter, or subscribe to our YouTube channel for more help, advice, and tips on treating, controlling, and beating your asthma.